It has been 65 days since nurses at Ford Genesys Hospital first hit the picket line. Now, hospital leaders say contract talks with Teamsters Local 332 have reached a standstill. As a result, Ford Health plans to move forward with new pay raises and staffing plans without a union agreement. Mid-Michigan Now's Andrea Flores is tracking the latest developments, and she's here with the details. Andrea, what does this latest development mean for the Teamsters and Henry Ford?
Stella, hospital officials say they've met with Teamsters leaders more than 60 times since April, but claim there's been no movement on key issues like staffing ratios and benefits. They now say talks have reached what's called an impasse, allowing the hospital to implement offered proposals while negotiations continue. Ford Genesys Hospital says registered nurses will see wage increases of up to 8.6%, with an average increase of 5.3% in the first year. Leaders say the new pay scale aligns with Genesys nurses across Henry Ford's health system, with added overtime and holiday pay opportunities. Hospital administrators say 60% of nurses will now make more than $100,000 a year, about $10,000 above the state average for registered nurses. Teamsters Local 332 President Dan Glass says their fight isn't about pay, but about protecting nurse-to-patient ratios and long-standing contract language. He doesn't believe they hit an impasse.
We've continued to modify our proposals and continue to negotiate in good faith, all while dealing with their bad faith bargaining. We're not going to stand up with it anymore. We're going to continue to negotiate, offer dates. We're going to continue to modify our proposals as we've done from the beginning of negotiations back in April all the way through the strike.
The hospital calls the move necessary to stabilize operations as the strike continues. A spokesperson says in a statement, quote, unilateral implementation of the hospital's proposal makes it possible for the hospital to operate under a new framework that reflects a deep commitment to nurses, patients, and long-term care for the community. Both Teamsters and hospital leaders say they will continue negotiations to reach a mutually agreed upon contract. However, they have not set a date for the next talks. Live in the studio, Andrea Flores, Mid-Michigan Now.